our next speaker is Nadine from the Mboa lab. So Barry, if we could spotlight Nadine right now. So our next speaker is not only is from Cameroon and from the Mboa lab, and has also been working on COVID-19 response in Cameroon and in Africa. Do we have Nadine? I see her here as a co-host.
Yeah, Nadine, you just need to turn your camera on, please. And I can spotlight you.
Great, thank you so much, Barry. And so we're so excited. So Nadine is also part of our current class of Community Biofellows and has been doing wonderful leadership work there. And we're so excited again, Nadine, for you to be here and for you to share with us your perspectives on your work in Cameroon. So thank you. Can everybody again join me in giving some claps and some snaps and some love for Nadine? So thank you so much, Nadine.
Thank you everyone. So happy to be a part of this great community, and also getting to meet very awesome and people who are very influential and helping the community to grow. So I am Mowoh Nadine from Cameroon. I am a researcher with a background in microbiology and have had at least 7 years of experience as a medical lab technician. But currently, I'm interested in science-driven research, mostly molecular biology, and we are mostly involved in helping to provide easy access or cheap access to molecular biology research tools and research reagents, especially in resource-limited countries like Cameroon, where we are. So Mboa Lab is a community biology lab and a makerspace for peace building, which is one of the nodes of the Open Bioeconomy Lab, a Cambridge-based lab under the Shuttleworth Foundation. And also we have Beneficial Bio, which is one of our projects at Mboa Lab, which is currently working in order to help increase the access of reagents and molecular biology tools to our local researchers in Cameroon. So the main actors here, which we've been involved in mostly our response to the COVID-19. We have the government who have put in place some strategies to curb the spread of the virus. So in Cameroon here, our government mostly were able to implement the compulsory wearing of face masks to limit the movement of people using public transports, and also to increase or improve the way people use hand sanitizers, and also encourage people to involve in hand washing often and frequently. And also we also have some main actors here as community biology labs, such as the Mboa Lab, that have also helped the government and also helped the communities in providing mostly PPEs, and also in sensitizing the population about the COVID-19 virus, and also helping to make sure that people stay at home, and also that if they are going to public places, they should be using their face mask. We also have some main actors like the non-governmental organization like the UN-AIDS, the MSF, WHO, and CDCs that have also been helping the government strategies by providing some technical support to the population. So the people directly involved or directly affected here by the COVID-19, and which we are targeting or looking at helping, are the poor and vulnerable groups and the healthcare workers. For the poor and vulnerable groups here, currently in Cameroon, we have a conflict which has been going on for like 4 years now. So we have some group of people from the English-speaking regions of Cameroon called the Northwest and the Southwest regions that have fled and moved to other places. So we discovered that they are the ones who are mostly affected because they have found themselves in zones where they are unable to eat, they are unable to find jobs, and then the COVID-19 coming again in place. It's really a devastating situation for them because they are unable to provide their essential needs. Healthcare workers here are the frontline people who provide us with the care, the support, and so they are the most at risk, working too with a population of people who hardly even believe that the COVID-19 is a real issue. So the impacts or the effects here that we've had We have socioeconomic effects. We've discovered here that all our 10 regions of Cameroon have been really adversely affected by the virus. And also the transport, entertainment, and leisure sectors have adversely been affected. And together with export and domestic movements have also been affected. We also have employment, income, and a given level of consumption. Here we find most people being laid off from their jobs. We find people being unable to work as much as they used to, and also what they are earning now is much smaller than what they used to before the pandemic. Also, education-wise, we find that most schools have been temporarily closed since the 18th of March that our government announced and declared closure of schools. And here it's a really big problem because in the Northwest and Southwest regions, that first of all had crisis and children were out of school for a long time. And since some of them had moved to these areas, the central region in Yaoundé, some in Douala, the big cities of Cameroon, where they were able to pick up schools and have been able to regain some level of education. But now with the coming of the COVID-19, they have all regressed back. So it's really a big problem. And also not only the students are affected, but teachers, especially those of the private sector, since there were no schools, they are not paid, they were unable to teach. So their families too are affected. We also have some health and environmental issues. Here, the added strain on healthcare workers, which carry with it considerable human security risk. Here, we discover that our healthcare workers are dealing with a population that are ignorant and that are difficult to talk to, difficult to reach, because they have the cultural or their myth, which says that COVID-19 doesn't affect Africans. Some believe that if they take some concoctions, they will be unable to contract the virus. And some visit hospitals only when their conditions become critical. So it's a difficult situation for healthcare workers, which puts them most at risk because they receive the patients only in very critical states. Also, we have a group of people that are very anxious and afraid, which are mostly the old people, since we all know that the COVID-19 affects mostly people that have maybe immune suppression, those that have some preconditions. And so these people continuously live in fear, and also there is stigmatization in a way that when you find yourself in public and you sneeze or cough, people will like look at you in a way, or some will even run away because of the fear of the COVID-19. So the strategies that the Mboa lab were able to put in place here to help the government and also to help our community was to minimize the impact on mostly poor and the vulnerable. These are the people we targeted most because they are the most affected. They are the ones who would have very little, no contact government. They are the ones whose voices are heard the least. Community labs, both national and international, to be able to get some diagnostic tools for COVID-19. And so we thought that this could help increase the number of people that could get tested. And also platform for us that helps researchers and also bring in experience that have accepted, and they are also able to work with us in case we have to do testing for COVID-19. At least they are able to do a PCR-based test. And so we are sure that if we are able to contact more of such institutions, we'll get a more efficient way of testing cerebrals. And also we do about the coronavirus, we talk about what we've been able to population. We also intend to generate and create jobs and reduce poverty in the process and support a faster economic recovery. Here we discover that the general population and the community are the target. If the community is satisfied, then we have here we are able to improve our reagent supplies through to local researchers through our Ben Bio, which is molecular biology reagents, and also meet the needs of our local about the coronavirus, the right information, because most people get carried away by wrong information. We provide them the right protocols, because people got into doing hand sanitizers and face masks without knowing exactly what's in the scientific backup. Also get into direct contact with our communities, and also give them some trainings and workshops. Okay, so for the outcomes, we have been able to successfully build a reliable relationship between community labs, between the community and also the government institutions. We have been able to have a population which is self-conscious and also have the problem-solving skills, and are ready to build a sustainable community together with molecular, together with community labs, and also to work hand in hand with the government. And also we've been able to improve a long-lasting hand hygiene practice. So we believe that by meeting the community, by reaching out to them and working together with them, we'll be able to curb the spread of the virus easily. Okay, I missed a slide here. So this is a slide which shows some of the work we've been able to do. The process where we were making hand sanitizer with what we got from our markets locally and what other people could get, some designs, fabric that are gotten from the market. And so thank you, everyone.
Everybody, can you guys join me in giving some snaps and some claps and some love for Nadine? Nadine, your work is so inspiring. I think hearing your talk and Linda's talk, both of you, your ability to, again, engage with your own local communities, but also to work collaboratively with the government is also really, really amazing. Can you, and actually we can have time for maybe one question. So if anybody has a question, you can put it into the chat. But one question that I have for you, Nadine, is how did Mboa Lab actually start to engage with the government? Can you talk a little bit more about what that process was like?
Okay, so we actually had somebody who knew how they put it, an official. So we had to write them a letter to ask them what they do, and also to introduce ourselves to them. We tell them we are Mboa Lab. We told them we are interested in helping the community, in helping our population to fight the pandemic which affects us all. We told them or gave them a sample of the resources we have, and asked also what they do or what they are interested in doing, and also what they've done so far with regards to the COVID-19. So we also told them we are involved in international collaborations, and our goal here is to be able to provide diagnostic tools, which is what we don't have here, especially the PCR-based, to be able to get more people tested and more efficiently. So they responded positively. They told us, okay, they are a research laboratory. They are also involved in the fight against COVID-19, and they are okay if we want to collaborate, and we've given them our goals, then they are ready for it. So one of them actually had to pay a visit to the Mboa Lab to see what we are doing, to see what we have, and to see what we are up to. So it's a pity that since it's a government thing with us here, they are not really very open to the media and all that. So we could not get a picture of the visit that we actually asked, but they turned us down. So we could not get a photo of him, yes. So that's, so that's it. So they are ready at any time, because we needed a place where we could go to if we have some samples to be tested, especially as we are involved in a number of collaborations. So they said they are.
Got it, Nadine. Okay, well, again, I think your story is so inspiring, and it's really amazing, I think, for all of us to see, your community lab, which I know was only set up not too long ago, already making such an impact in your country and in a real tangible way with responding to COVID-19. So thank you again for sharing your story and for all of your incredible work. Tomas and Mboa actually will be here as part of our global collaborations panel, which Maria is going to be moderating a little bit later. So we'll hear more about Mboa's lab activities then. And again, just as a shout out to, Nadine is also a part of our fellowship program. So when we launch it next, please do apply. It's really wonderful, and we hope you join us. So everybody, can you join me in giving some more snaps and some love for Nadine? Thank you so much again, Nadine. Just really appreciate you, and you're such an inspiration. Thank you.